Welcome to our health podcast. This will be presented by Mary Mirza,
Maria Maka, and Shannon Nolan.
For this task, our focus question is, what do you do if students in your class are ready to learn certain things and some are not? First of all, what is health? According to the World Health Organization, health is a state of complete physical, mental and social well-being and not merely the absence of disease or infirmity. The Australian curriculum states that the Health and Physical Education program is designed to allow schools to meet the learning needs of all young people, mainly in the health-focused area of relationships and sexuality. All school communities have a responsibility when implementing the Health and Physical Education curriculum to ensure that teaching is inclusive and relevant to the lived experiences of all students. This is particularly important when teaching about reproduction and sexual health to ensure that the needs of all students are met.
Based on the Department of Education website, health education covers the following topics: healthy eating and oral health, physical activity, mental health and well-being, safe environments, sun protection, sexual health and well-being, tobacco control, alcohol and other drug use. Some students might not be ready to learn about sexual health and well-being or alcohol use and drug use. It is more common to hear parents swapping stories about children's first teeth and first steps than it is to hear about a child's sexual development. This is understandable, as it's often seen as a very personal aspect of a person's growth and development. Choosing the right age to answer questions such as, where do I come from and what is sex, is more about how comfortable your family feels talking about such topics rather than being the perfect time. Talking about these issues shows students that they can talk with trusted adults. If families and schools won't take the subject on, children will turn to other sources of information that may be not reliable, such as friends and internet or media. In terms of tobacco control and alcohol and drug use, few students might not be ready to learn about this in primary school, but the Department of Education website mentions that drug education is very important as it can play a counterbalancing role in shaping a normative culture of safety, moderation, and informed decision making. Also, engaging students in drug education activities assists them to make healthy and safe choices, identify risk situations, and develop strategies to prepare them for a challenging future.
When it comes to learning about health in schools, some students may be more ready and willing to learn about certain topics than others. This is not always the student's choice though. Sometimes other factors could come into play that affect the child's readiness to learn about these health topics. These other factors may include family beliefs, the child's upbringing and home life, the child's cultural and or religious background, their level of maturity and also their gender. A child's family beliefs may disadvantage their learning about health, as sometimes a child's parents are adamant on preventing their child from learning about certain topics because they may feel the child is not yet old enough to learn these things. The family beliefs can also be linked to the child's upbringing, as it would have a major impact on the child's readiness to learn. As well as family beliefs and upbringing playing a crucial role in the child's inability to learn about these things, the child's own level of maturity is highly important. Each child psychologically matures at a different rate to any other child. No two children mature the same way at the same time. The gender of the child may also be a significant reason as to why some students may be ready to learn health in schools. Depending on the age of the students, their gender could have an effect on their level of maturity, readiness, and willingness to learn about specific health topics.
In regards to the classroom and education, students come to school ready to learn but with differing experiences and knowledge to draw upon. According to the North Central Regional Educational Laboratory, to promote learning for all children, educators must provide a school environment that acknowledges children's diverse backgrounds, helps children transition comfortably into the next instructional level, and provides community support when necessary. Such provisions support each child's readiness to learn, as well as each school's readiness to educate young children on particular topics. In addition to this, when teaching sexual education in the classroom, it is important to consider tailoring the unit of work to the group of students it is aimed at. This will provide a safe and reassuring environment in which all students are supported and feel ready to learn. The teacher must therefore take into consideration differing cultural perspectives, as this will give them an idea about the beliefs and values on what is considered to be appropriately taught at certain ages and life stages, as well as individual students' needs and what the students are asking and wanting to know. Creating a supportive environment is especially important during the teaching of sexual health and education, as it is a subject that can be uncomfortable or confronting for certain students. According to the Department of Education and Communities, it is therefore vital to develop an environment where students feel they are able to ask questions, being anonymous if wanted, and enable students to withdraw from the class if they feel that they want to, therefore giving them the choice and freedom to do what they feel without judgment or consequence. Before starting a particular unit on health education, it is also vital to develop a partnership with the school community and parents, as they will provide the most accurate representation about their own child.